It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We're continuing our show today with our next guest, Dr. Grant Garcia, orthopedic and sports medicine physician from Orthopedic Specialists of Seattle. Patellar tendon ruptures. That's got to do with the knee, doesn't it?
Exactly right. You're exactly, boy, Tom, you are getting good. That's the tendon that connects your kneecap to your tibia, sometimes called the patellar tendon or the infrapatellar tendon.
All right, let's hear what Dr. Garcia has to say with Shannon O'Kelly.
Dr. Garcia, thank you so much for joining us. How are you?
I'm good. Thanks for having me.
We're going to talk today about infrapatellar tendon ruptures, tears, tendonitis. But before we get into the topic, tell us about your practice. Tell us about your focus. You're an orthopedic surgeon. You have a fellowship in sports medicine.
Correct.
So tell our listeners kind of your interest, how you got to where you are, and what your practice looks like.
Okay. Well, first off, I grew up in Mercer Island and then did all my training on the East Coast. So I trained at Penn and Philadelphia and then New York, Hospital Special Surgery, took care of a lot of professional athletes, and then did my fellowship at Rush in Chicago with the Bulls and the White Sox. So that was a great experience. And then coming back here at home was excellent, both for my wife, who's from Mercer Island as well. And my main focus of practice is really high-level sports. So I do any types of sports stuff, knee, shoulder, and elbow. Also fellowship trained in biologics. So I combine that from my experience both on the professional and college level, and then in general from my studies with my surgical procedures or non-operative treatments.
Okay, so let's talk about the knee. In particular, let's talk about the infrapatellar tendon. So let's set that up anatomically, and then we'll get into kind of some diagnoses and some treatment.
Sure. So there's, you want to think about, first of all, talk about the bone, the patella itself. And there's two attachments. There's the quad tendon that comes up from above, and then below is the patella tendon. The one we're talking about today is the patella tendon itself, and that's because it usually is tears in people under 40 years old. When you're over 40, you want to think more about quad tendon. But really what's important for the listeners, I think people want to know all about, is the athletes and what are they getting. And in most cases, the tendon they're tearing is the patella tendon. And I know you know the Will Dissly is the most recent person that had this injury. So that's sort of the reason we're talking about this topic, to better understand it.
And so the tear, pretty large tendon. Tell us about the mechanism, kind of the symptoms and signs. And usually if you tear this tendon, the athlete pretty much recognizes, oops, there's something wrong here.
Yes. Well, in most cases, sometimes there's a preceding issue. So sometimes they have patella tendonitis. Maybe they've had an injection before. But in a lot of cases, we really don't see it coming. And then when this happens, it's an abrupt tear, basically landing. A lot of times you'll see on the field, or if you watch these videos from them getting injured before, when they land in a flex position, and then you have the rupture here. That's exactly how Richter Cruz did it when he injured his.
And so that loading at landing, that's a stressful loading. We call that eccentric loading. And that puts a lot of tension, a lot of stress in that tendon.
It does. And then based off of the assumption that this doesn't happen to everybody who does this, because you have so many high-level athletes playing, there's probably a predisposition in terms of weakening of the tendon. And we don't always get told anything if these professional athletes are getting, whether it's PRP injections, cortisone injections into the tendon. So it's really hard to tell what the predisposing factor was. And really, for a surgical standpoint, the key is to make sure we do a good reconstruction and a good repair.
And you're talking about professional athletes. As an orthopedic surgeon and fellowship trained in sports medicine, would you ever see this in a high school athlete or a collegiate athlete? Me personally, I've never seen it in a youth athlete, a high school athlete. Have you ever seen it happen in that age range?
I've seen in college level, usually linemen, they're usually like 340, 400 pounds. So they're NFL size already.
Exactly, yeah.
But outside of that, for the standard athlete, you don't see it that often. In general, it's not a common thing for a young patient in general.
And when these tear, the ones I've seen usually tear off what we call the tibial tubercle or come off the patella. Have you ever seen mid-tendon tears? What do you mostly see?
Most of the time you see it actually off the patella. The tibial tubercle is a lot less common in my experience. And then the mid-substance happens. Those are really hard to fix, though, in general, but again, those are less common. So the most common one's also the easiest one to fix, which is good.
And most times, symptom-wise, these athletes, when this happens and they land and they're loading, if you watch it on TV, you can see them almost like something happened.
They crumble. They're not able to do anything else.
And it's pretty loud. It can be a lot of times the patient will describe, I felt something, pull, and I heard a pop.
Yeah, and that's similar to the way you hear about Achilles tendon ruptures. Some people sometimes even describe it as getting shot in the back of the leg. They feel like someone shot them. So this is the same experience. Because of the thickness of the tendon and the amount of force and tension on it, you have that snap sensation. And it's almost instantaneous. They know what happened.
Our conversation with Dr. Grant Garcia and Shannon O'Kelly continues next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Grant Garcia and Shannon O'Kelly on the patella.
Dr. Garcia, again, thank you for joining us. We're talking about patellar tendon ruptures and tears in athletes. You're a fellowship-trained orthopedic surgeon dealing with these athletes who want to get back to the field, the court, or whatever it may be. So now we've had a tear. We pretty much know it's a tear because the patient describes the symptoms: a large pop, maybe a pull. They're not mobile. From a diagnostic standpoint, when they get into your office, what are you going to do?
Well, I always get an X-ray in general to make sure I'm not missing anything else or it was an avulsion of the tibial tubercle. Then, you're going usually straight to MRI, but you can pretty much diagnose it in the office itself, but the MRI gives us more evidence in terms of where it was torn off, and that helps us plan the surgery out, and just comes in there so we can do this more efficiently and do a good job.
Well, I can appreciate the tension going through this tendon with an athlete, landing, jumping, the strength in the quad muscles. I mean, how do you repair that so it doesn't get damaged or retorn? I mean, it's complicated. I mean, you're suturing this thing together. You need to know what you're doing. You need to kind of create some tension in there. I mean, there's mechanics involved here.
Absolutely. Well, there's different levels of repair, and I go over them very briefly. And that's really how we got to the point where now we think we're getting patients, these NFL players back. Originally, it was 50% return to the NFL, but we've seen some Maurice Claiborne, Jimmy Graham, and then Victor Cruz all come back and play at a pretty high level afterwards. And basically, the old way of doing it is you make 3 tunnels in the bone with sutures that are wrapped around the tendon, and you tie them from the other side. Larger incision, a little bit older version of doing it. Second version is where you basically repair the tendon back with these newer suture anchors, 3 anchors in there. Similar concept in terms of the 3 spaces, but you're not putting holes through the patella itself. And then these high tensilin sutures are very, very high level to the point now, the newer versions, that we can start doing our repairs sooner. But really where the trick is with these high level athletes, something called an internal brace. So it's a pretty new thing. We do it a lot for that Tommy John, ankle ligaments. What we do is think about a bridge. You have a nice bridge, flat bridge there, but you don't have suspension. So you've repaired the bridge. Now you put this suspension belt on it, and patients, instead of like for rehab we were starting them at 6 weeks, they're starting at 4 weeks, which is really important. And then if you don't do that, the other option is using cadaver tissue or their own tissue, and I've done that for some of the NFL players before, but the brace is the newer thing we're talking about. And then we always sometimes, especially in these NFL athletes, we're always adding biologics, so you can do bone marrow aspirate or PRP, and I think that's the main thing about repair. But I will say, you got to give credit to the rehab. Really, that's just as important. And so I found that because we have these sutures, we can rehab sooner. And that's really what's getting this, I think, going to bring this 50% rate of return up, is the better rehab as well, because we can go sooner. Another thing is, something that's interesting is there's something called the blood flow restriction, which you may have heard of. But basically what it means is you put a tourniquet on. It's FDA approved and safe. And what you can do is you can start rehabbing them sooner, because what you're doing is you're only putting 20-pound load on their knee, but the muscle thinks it's a 100-pound load. So think about that with a professional athlete. You start doing that early, they're back a lot faster. And I think that's why we're seeing some of these, freak returns in the NFL.
When you talk about the suspension, I mean, as we wrap up here, I think our listeners are going, well, what are you using? I mean, you talked about a graft. Now, suspension, is that a tissue that you're sewing on underneath the suture, over the sutures, to enhance that repair?
It's actually a suture with collagen embedded in it.
Wow, great stuff. I mean, it's so fascinating what's going on in sports medicine today, and athletes returning after. This is a significant injury. Dr. Garcia, again, thank you for your time. You did a great job explaining it. I know our listeners are going, now I understand what's going on. Thank you.
Thank you for having me.
All right, that's been Dr. Grant Garcia from the Orthopedic and Sports Medicine Orthopedic Specialist of Seattle, patella tendons, and orthopedicspecialistofseattle.com if you'd like to get more information. This is something that can hurt sometimes without actually being severely damaged, right?
Yeah, that's right. You can get infrapatellar tendonitis, and sometimes that's the predisposition to having it tear.
Okay. We'll come back with our final segment after this timeout right here on Como.